practices, build awareness about food and fiber production. And our initial focus areas are threefold. 1, preventing and mitigating pain in farm animals. 2, promoting living environments that meet the animals' physical and psychological needs. And 3, ensuring humane end-of-life practices. Fafa strives to cultivate a culture where animal welfare is not just a checkbox, it's a fundamental aspect of responsible stewardship. Fafa membership is available to veterinarians, veterinary students, and affiliates. Affiliates are professionals who are supportive of and want to be involved with the work of Fafa. This includes veterinary technicians, teaching professionals, researchers, individuals with a career and/or advanced degree in animal production, animal welfare, animal science, and passionate advocates. Membership is free for the first year. You can join by using the QR code shown on the screen, visiting our website at www.vafa.org, or just typing in membership in the Zoom chat. Member involvement is critical to advancing our mission. We are so grateful to those who have in the webinar who have already joined and encourage everybody else to do the same. Now, I have the honor of introducing today's speaker, someone who is truly dedicated to animal welfare. Dr. Abigale, or Abby Zoltick, is a veterinarian and the Director of Education for Fafa. She's an animal welfare resident at the University of Pennsylvania School of Veterinary Medicine, where she's also pursuing her Master's of Science in Animal Welfare and Behavior. Prior to veterinary school, Dr. Zoltick spent 8 years living and working on farms in Scotland and in the United States, working with cows, pigs, chickens, everyone. So she also has experience working with farm animals as well as students. And so we're really lucky to have Abby join us here today. Before we get started, just a few housekeeping items. Hold on a second here. Want to make sure I cover everything. Oh. I'm sorry, guys. My computer, of course, is giving me problems right now. Okay. Before we get started, just a few housekeeping items, because there's a large group joining us today. Your microphones are on mute, and questions will be taken using the chat box. You are welcome to submit questions throughout the presentation, and we will answer as many as time allows at the end of Dr. Zoltick's presentation. Abby, it's all yours.
Okay, can everyone hear me okay?
Yep.
Okay, thank you, Susan, for that introduction. Thank you, everyone, for coming today. I'm very excited to present our first webinar. Before we begin, I want to say that I have no conflict of interest. I'm not affiliated with any company, pharmaceutical or otherwise. I also want to mention that we have a very diverse audience here today, from veterinarians and veterinary technicians to welfare scientists, educators, lawyers, animal caretakers. So some areas of the webinar will be a review for some of you and a little more technical for others. Please bear with me. The entire webinar will not be technical. We also have participants from around the world joining us today, and pain in farm animals is a global concern, so we're very excited to have this international audience. And though the information on pain is widely applicable, the drug approval process and regulations and guidelines that I discuss are specific to the US. So this is an overview of where we're going. We'll begin with an introduction to pain physiology and how this relates to targeted analgesia. We'll then talk about common causes of pain in farm animals. Next, we'll discuss barriers to analgesic use, and then move into analgesic options and the drug approval process. And from there, we'll investigate methods of pain detection. And with a focus on animal cognition and pain pathology, we'll discuss why pain mitigation is so critical to animal welfare. And then lastly, we'll conclude with goals for moving forward. So now an introduction to pain. And this is a definition from the International Association for the Study of Pain. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. But to understand pain and to really appreciate its significance, we need to first distinguish between nociception and pain. So nociception is the processing of a noxious stimulus within the central and peripheral nervous systems. So it is sensory. Pain, on the other hand, is a subjective cerebral experience that's going to be felt in response to activation of these pathways. So it has both sensory and emotional components. So to connect nociception with the experience of pain, we need to explore the pain pathway. And that's going to include the process of transduction, transmission, modulation, and finally, perception. So a noxious stimulus is detected by specialized sensory receptors that we call nociceptors. And nociceptors are found in the skin, the muscles, joints, viscera, even the vasculature. And if tissues are undisturbed, the nociceptors are going to be inactive. But if a noxious stimulus exceeds the stimulus threshold, transduction occurs. And transduction describes the process in which a noxious stimulus is converted into an electrical impulse known as an action potential. And this action potential then travels from the periphery to the central nervous system in the process known as transmission. And this action potential is then going to travel along the ascending and descending pathways of the central nervous system where it is modulated. And this process is going to result in either enhancement or suppression of the nociceptive signal. And then lastly, the signal is processed, integrated, and recognized in the higher centers of the brain. So we have pain perception. And understanding this pathway is critical to understanding targeted analgesia and implementing a multimodal approach to pain management. So by targeting different levels of the pain pathway, we can really maximize our analgesic efficacy. So in an animal experiencing normal sensation, noxious stimuli activate nociceptors, leading to pain. And then our innocuous stimuli or harmless stimuli, so things like a light touch or a breeze, are detected by low threshold mechanoreceptors, which normally will not communicate with the pathway and instead will result in touch sensation. And there are two types of nociceptors. We have A delta fibers, which are myelinated, and so they rapidly conduct this localizable pain. And then we have C fibers, which are non-myelinated and consequently are going to conduct pain more slowly. And then our A beta fibers are not nociceptors. They are sensory neurons that detect innocuous stimuli, resulting in this sensation of touch. Now, adaptive pain in animals is protective. So pain can result in, for example, a withdrawal reflex to prevent sustained tissue damage. So if we touch a flame, we're going to pull our hand away. It can result in behavioral changes that foster healing. So as an example, an animal with an injured limb will avoid bearing weight on that limb, which supports the healing process. And much of what we understand about pain physiology derives from the experience of humans, most of whom are capable of self-report. And the nervous system is highly conserved among mammalian species, so the basic principles of pain can be applied to other animals. And we have evidence that nociception is not limited to mammals. Nociceptors are found in non-mammalian vertebrates, so our birds, reptiles, amphibians, fish. They've even been found in invertebrates like the common fruit fly. However, we need to draw caution when extrapolating data from human subjects, especially in terms of pain detection. And this is because of interspecies differences in the expression of pain. And this is particularly relevant to our farm animal species. So prey species have evolved to mask pain. They don't want to signal vulnerability to potential predators. And the problem here is that this stoicism can challenge pain identification and lead to this dangerous and false assumption that farm animals experience less pain or do not experience pain at all. So moving into common causes of pain in farm animals. The most common causes are management procedures and common disease conditions. So painful management procedures are routinely performed on farms, and it's often for management efficiency and to protect worker and animal safety and welfare. But the need for these procedures often has to do with the management and housing designs that we have in place within the current production systems. And it's important to note that these procedures are not blanket performed on every single operation, and there is variability in how these procedures are performed. But some common procedures include castration, which is performed to minimize animal aggression and prevent unwanted mating. In pigs, it's also performed to avoid boar taint in meat. Disbudding is when the horn-producing cells of calves or kid goats are destroyed via hot iron or caustic paste prior to skull attachment, and this is performed to protect both workers and animals from injury. Tail docking or amputation of the tail is performed in lambs to prevent what is known as fly strike, and this is a parasitic infestation of fly larvae, and in piglets to prevent tail biting. Beak trimming is performed in chicks to prevent feather pecking and cannibalism, and branding is used as a form of identification in cattle. And based on scientific evidence, we know that all of these procedures cause pain. And guidelines exist for the management of pain associated with some of these management procedures. So as an example, the American Association of Bovine Practitioners and the American Veterinary Medical Association have established recommendations to guide the management of, for example, pain associated with castration and disbudding in dairy calves. And there are also industry-driven programs. So for example, the Farmers Assuring Responsible Management or FARM program that provide guidelines for some painful procedures. However, this does not translate into consistent use of anesthetics or analgesics among producers or veterinarians. Moving forward, ideally, we avoid the need for these painful procedures by implementing alternative or modified methods of management and genetic selection. However, when painful procedures are required for animal and human safety and welfare, the least painful method available must be used. The procedure must be performed as early as appropriate to minimize tissue damage. And we need to implement a preemptive and multimodal targeted analgesic approach. So this means both preemptively providing anesthesia or analgesia to prevent pain, and also using different pharmacological classes of analgesics to target different levels of the pain pathway. And we also must ensure adequate duration of pain relief, which may require drug administration during the post-procedural period. So studies that demonstrate the chronicity of pain associated with specific procedures can really help guide our understanding of the need to re-administer an analgesic drug. So that all of this information isn't too abstract, let's apply what we just discussed to disbudding as an example. So a potential future alternative to eliminate the need for this painful procedure is polled genetics, so to breed for animals that do not develop horns. And the horn-producing cells attach to the skull at around 8 weeks of age. So this procedure must be performed before this time. Otherwise, it becomes surgical dehorning, which is a more invasive procedure that is going to result in more pain. And if caustic paste is used, it must be applied before 2 weeks of age. And we do not yet have clear data indicating which procedure is more or less painful. Hot iron disbudding, which is much more commonly performed, is going to result in more acute and immediate pain, but the pain associated with a chemical burn may be longer lasting. And disbudding has received more attention than other painful procedures. So we have recommendations from veterinary organizations and industry-driven programs. And so standard practice is to provide a preemptive and multimodal analgesic approach. So this includes a local block, generally a corneal nerve block with lidocaine, which is going to address the acute procedural pain. And then in addition to an NSAID like meloxicam, which addresses the post-procedural inflammatory pain. And I do want to note that providing analgesia is not standard practice for most painful procedures. So beak trimming, tail docking, castration, these procedures are often performed without anesthesia or analgesia. And it is one step at a time. So we need to prioritize addressing acute procedural pain and the inflammatory pain that immediately follows. However, studies by Adcock and Tucker demonstrate that following cautery disbudding, calves experience what's called evoked pain. So they demonstrate increased sensitivity in response to a stimulus for 9 weeks. And they experience ongoing pain. So this is pain that is experienced without any stimulus for at least 3 weeks. So we need to ensure that our analgesic protocol is providing adequate duration pain relief based on the available scientific data. So a study conducted by Reedman and colleagues in 2022 demonstrated that an additional meloxicam administration 3 days post-disbudding resulted in reduced wound sensitivity. So we need to consider this available scientific data when determining best practices. And it's also obviously important to remember to improve upon practices as new research emerges. Now, pain that often receives even less attention on farms is the pain associated with disease. So we often emphasize disease resolution with, for example, antimicrobial use, often without addressing the pain associated with a disease condition. So common disease conditions that affect many different farm animal species include lameness, dystocia, inflammatory conditions associated with reproduction and lactation like metritis and mastitis, and then also diseases that we may not intuitively associate with pain like pneumonia or scours. And whereas guidelines exist for the management of procedural pain, similar guidelines do not exist for the management of painful disease conditions. So many disease conditions are under-recognized as painful. There are a scarcity of studies evaluating this associated pain. And as a result, the pain associated with disease in farm animals is undertreated or untreated. Moving forward, we need to focus on reducing the risk factors associated with the development of painful disease conditions. So this includes alternative or modified management practices, genetic selection, and preventative measures. We also need more studies evaluating the pain associated with disease. This will help inform evidence-based guidelines for the management of painful disease conditions, which will ultimately help to support implementation of on-farm pain management protocols. So moving into barriers to analgesic use. There are many barriers to analgesic use, and we'll start with economic and management constraints. So the cost of the drug itself can serve as a barrier, as well as, since we're talking about food production animals, the associated milk and meat withdrawal periods. The time that it takes to administer the drug, the time between administration and the onset of pharmacological activity, and the need for repeat doses due to short duration of activity may all disincentivize a producer from using an analgesic drug. And there are times when administering an analgesic minimizes labor. So, for example, providing anesthesia prior to disbudding makes this procedure easier and safer. It's going to be much easier to handle a calf that isn't in pain. However, Administering analgesics can also, in many circumstances, require additional labor due to animal restraint, which may also introduce worker safety issues. In terms of pain detection, we discussed farm animal stoicism, which challenges pain identification. There are also a lack of studies that validate species-specific pain indicators and a lack of validated and practical on-farm pain scoring systems. Now, all of this is compounded by attitude constraints. So there is a misconception, often related to farm animal stoicism, that farm animals are less sensitive to pain. There is also the misconception that neonates do not experience pain, despite the fact that there is no scientific evidence to support this. I've also heard this is how it's always been done, or it causes the animal more stress to administer the analgesic than to just perform the procedure. And then lastly, we have our pharmaceutical constraints. So in the farm setting, drugs like the opioids cannot be safely dispensed. Many of the drugs that we use in an extra label manner need to be administered intravenously or intramuscularly, or as we discussed, they require repeat doses due to a short elimination half-life, further inconveniencing producers. And then, of course, we have a lack of FDA-approved drugs for farm animals labeled specifically for pain control. So moving into analgesia and the drug approval process. Currently, there is only one FDA-approved drug labeled for pain control in our food animals in the US. And this is a flunixin transdermal poron solution known as Banamine transdermal. So this is a non-steroidal anti-inflammatory drug, and it's labeled for the control of fever associated with bovine respiratory disease and acute bovine mastitis. And though it is labeled for pain, it is labeled only for the pain associated with foot rot in cattle. So it is specific and exclusive in terms of both species and disease condition. So the most common drugs used in livestock medicine are local anesthetics and NSAIDs. However, these are not FDA approved for pain control. So consequently, we need to administer drugs in an extra label manner under the Animal Medicinal Drug Use Clarification Act of 1994. So under AMDUCA, there must be an established veterinary client-patient relationship. It must be an FDA-approved animal or human drug. It cannot be used to enhance production, and it is prohibited in feed. And there also must be strict adherence to withdrawal periods to ensure that there are no violative drug residues in the meat or milk. And this burden is really shouldered by the veterinarian when a drug is not FDA approved with established withdrawal periods. Now, the veterinary drug approval process varies among countries. In the US, the Food and Drug Administration Center for Veterinary Medicine approves animal drugs. So under the authority of the Federal Food, Drug, and Cosmetic Act, the FDA CVM publishes what's called the Code of Federal Regulations, which outlines the regulations governing the introduction of veterinary drugs. And the process for approval does not begin with the FDA CVM. It begins with the drug sponsor. So the sponsor will research and develop the new drug. They'll conduct pilot studies, and the sponsor needs to submit a new animal drug application. And the Animal Drug User Fee Act gives the CVM the authority to collect fees from the sponsor in order to review the new drug. And drug approval for commercial marketing requires, first of all, safety for the target species, human consumer, animal handler, and the environment, appropriate labeling, including safety, storage, handling, and withhold information, quality manufacturing, and lastly, pharmaceutical efficacy for the stated purpose. So this requires valid, reliable indicators of pain. So species-specific validated indicators of pain are critical for FDA drug approval, and pain indicators help us to detect the presence of pain and determine its intensity. This is essential to determining analgesic efficacy so that we can then implement appropriate therapeutic intervention. So moving into pain detection. So how can we detect pain in animals that cannot verbally communicate with us? And this is a quote from Molyneux and Kent. Pain changes the animal's physiology and behavior to reduce or avoid the damage and to promote recovery. So we can use these alterations in physiological and behavioral parameters to detect pain. So first we'll address the physiological response to pain. Noxious stimuli can activate the hypothalamic pituitary adrenal axis and the sympathetic adrenomedullary system, resulting in physiologic changes. So, in response to a nociceptive signal, the hypothalamus releases corticotropic releasing hormone to the anterior pituitary, which in turn is going to release adrenocorticotropic hormone to the adrenal gland. Now, in response to this stimulation, the adrenal cortex releases cortisol into the bloodstream. So then we get our physiological changes related to the stress response. And nociceptive signals also stimulate sympathetic nerve fibers that innervate the adrenal gland. And this stimulation is going to cause the adrenal medulla to release catecholamines. So our epinephrine, norepinephrine, what we relate to the fight or flight response. So physiological measures of pain include cardiovascular, respiratory, endocrine, electrophysiological, even immune responses. And when I refer to physiological parameters, I'm really referring to physiologic and our neuroendocrine measurements. This is by no means an exhaustive list, but these are just some examples of measures. So in relation to the HPA axis and the sympathetic adrenomedullary system, which we just discussed, we may look at cortisol or norepinephrine. The biological stress response can also impact heart rate and respiratory rate. Substance P is a neuropeptide that has been investigated as a potential pain biomarker in farm animals. Inflammatory products, so fibrinogen, haptoglobin, may suggest pain because inflammation often elicits pain. And then electroencephalographic signal variations have also been reported during painful procedures in farm animals. And the advantage of physiological measurements is that they're often more objective, and it's often easier to detect and quantify changes. However, data collection may require specialized equipment, technical skill. Data collection may also be more invasive and can be confounded by other factors, factors other than pain like stress, physical activity, if the animal is in estrus. So this is going to minimize our testing specificity. And then lastly, the biological stress response does not necessarily signify pain perception. So for our behavioral parameters, again, this is by no means an exhaustive list, but these are some examples of behavioral measurements that we can use to detect pain. So alterations in social contact, feed intake, ear or tail position, posture, physical activity, even facial expression. An animal may direct a behavior towards the affected area. So as an example, licking or rubbing the scrotal region after castration. And the advantages of behavioral measurements are that they can be conducted on farm with direct observation and minimal disruption to the animal. And for research studies, we're generally using video recording, so our presence doesn't impact behavior. And we can also use behavioral observations to localize a painful region. And these indicators can be detected in real time and are sensitive. Now, the disadvantages include a greater risk of bias. It can also be very difficult to distinguish between pain behavior versus sickness, stress, or discomfort behaviors. And then, as we discussed, farm animal stoicism can really challenge this method of pain identification. However, behavioral changes bring us closer to the inner experience of the animal. So I want to talk about facial expression briefly. The Grimace scale, as it's called, was originally established to detect pain in laboratory mice, and it's a potential tool to assess pain in real time. It's designed to detect subtle changes in facial expression and then correlate these changes with pain. So some example facial expression features examined include ear position, tension around the eyes, nostril dilation, muscle tension on either side of the head. And these scales vary depending on the specific species, but they have now been studied in cows, sheep, and pigs. So moving on to why pain mitigation is so critical to welfare. And I'm going to start by talking about studies in animal cognition. So let's say we detect physiological and behavioral indicators of pain in an animal. We need to ask, does this matter to the animal? And how do we know if this negatively impacts their welfare? So studies are emerging that explore the emotional experience of animals. And animal cognition studies may demonstrate the emotional aspect of pain by revealing an animal's affective state. And the affective state describes this long-lasting mood or emotional state. So physiological measures, like what we talked about, things like heart rate, may tell us about emotional arousal, but they don't illuminate emotional valence. So whether the animal is experiencing positive versus negative emotions. So studies that demonstrate a negative affective state capture the negative emotional valence associated with pain. So there are studies that evaluate, for example, anhedonia, or reduced motivation to engage in activities that one once found pleasurable. So a study conducted by Mintline et al. Demonstrated that calves will engage in less play behavior post-disbudding, and Licor and colleagues observed calves decreasing their intake of a sweetened solution after disbudding. So these studies illustrate that calves are no longer motivated to engage in activities that they normally enjoy after this painful event. Studies also demonstrate that animals will engage in avoidance behaviors that minimize the risk of re-exposure to pain. And this is called conditioned place aversion. So in a study conducted by Thomas Eady and colleagues, calves avoided the pen in which they had experienced disbudding. And this demonstrates that animals have lasting memories of these painful experiences. And then there are studies in which animals experience pain, choose to self-medicate, which also demonstrates these motivational changes. So Danbury et al. Observed broiler birds suffering from lameness and found that they had increased motivation to consume feed mixed with analgesics compared to control animals. And a study conducted by Adcock and Tucker revealed that when trained to associate a stimulus with either a lidocaine injection or a control saline injection, disbudded calves chose to approach the stimulus associated with the lidocaine injection. And this is very telling because lidocaine can be aversive to calves. So as in humans, it can cause a burning sensation. So these calves were willing to, in a sense, pay a cost to achieve relief from the pain associated with disbudding. So another test that strives to capture emotional valence is the cognitive or judgment bias test. So here we have an animal. In this example, I've chosen a pig, and we teach her that if she goes to the bucket on the left, she receives a food reward, or she experiences a positive outcome. If she goes to the bucket on the right, a startling whistle sounds, so she experiences a negative outcome. So once she's trained, we'll see that she quickly and eagerly approaches the bucket on the left, whereas we're going to see greater approach latency for the bucket on the right. So now that she's trained, we present her with an ambiguously placed bucket, so a bucket somewhere in the middle. So what we're investigating based on her response is what she anticipates or expects, something positive or something negative. So if she approaches this ambiguous bucket, we interpret this as an optimistic outlook or a positive affective state. So she expects a food reward. Whereas if she avoids it, we interpret this as a pessimistic outlook or a negative affective state. So she's in such a negative emotional state that she just anticipates something aversive. And then we can also ask, what if she undergoes a painful experience? Will this impact whether or not she approaches an ambiguous stimulus? So in a study published in 2013, Neve and colleagues used the cognitive bias test to determine if calves are more pessimistic after hot iron disbudding. So what they did is they trained calves that if they approached a red screen, they received a milk reward. And if they approached a white screen, they received a milk timeout. They then presented calves with this ambiguously colored screen. And the researchers found that the calves were less likely to approach this ambiguous screen after experiencing disbudding. So after experiencing this painful event, they no longer anticipated something good like a milk reward. So they didn't even put in the effort to approach the screen. And this demonstrates a negative judgment bias, which the researchers interpreted as a negative emotional state. So why are preemptive and multimodal approaches to pain management critical? And we can see from animal cognition studies that pain profoundly impacts an animal's welfare. So a painful experience, it can lead to anhedonia, it can lead to a lasting memory of the negative experience. Painful experiences are significant enough to lead to motivational changes in animals, such as avoidance behaviors and efforts to achieve analgesic effects. Pain prevention and mitigation is also critical to prevent the development of pathological pain. So if pain is prolonged and unabated, it can lead to maladaptive pain or pain that persists in the absence of a noxious stimulus. And it serves no protective function because it's not encouraging healing. So when we have tissue injury or inflammation, we can develop what is known as peripheral sensitization. So neurotransmitters and inflammatory mediators lower nociceptor activating thresholds. So what this means is that a less intense stimulus is required to activate pain pathways. And we have this exaggerated pain response. And this is known as hyperalgesia. And then our A beta fibers that do not normally respond to noxious stimuli may communicate with the pain pathway, resulting in what is called allodynia, in which innocuous stimuli, our harmless stimuli, actually activate nociception and lead to the experience of pain. So hyperalgesia and allodynia do not always indicate a pathological pain state. However, protracted and unmitigated pain, so when we have these continuous high-intensity nociceptive impulses, we can develop what is called neuroplasticity and central sensitization. So central sensitization results in actual changes to neurons of the central nervous system. So consequently, pain is not appropriately coupled with peripheral stimulation. So central sensitization can result in spontaneous nerve firing, reduced nociceptor thresholds, heightened sensitivity to both harmful and harmless stimuli. And this heightened pain sensitivity is maladaptive because it's serving no protective function. And we also have these modulatory systems in place that inhibit pain. So we have, for example, the endogenous opioid system. And central sensitization can lead to disinhibition. So these modulatory protective systems are no longer functioning. And there is evidence of this process in farm animals. So available studies demonstrate chronic hyperalgesia in tail-docked piglets, beak-trimmed chickens, cattle suffering from lameness, and disbudded calves. And this type of pain is much more challenging to treat. And I want to note that central sensitization really revises our understanding of pain. So pain does not only arise from pathology or peripheral noxious stimuli. When pain is protracted and unmitigated, so when we fail to treat pain, it can lead to central neuronal plasticity, resulting in actual functional alterations to neurons, and this can lead to chronic maladaptive pain with long-term welfare implications. And painful management procedures, as we discussed, are routinely performed on neonatal animals, and neonates are uniquely vulnerable to neuroplasticity due to this developing nervous system. And studies in both human and rodent models demonstrate that neonatal animals experience nervous system changes in response to painful events and in response to tissue injury. And this can result in altered pain sensitivity that can even persist into adulthood. So we also know from rodent models that early life inflammation can negatively affect an animal's ability to cope with fear, anxiety, and stress, and it can impair social and cognitive development. So lastly, goals for moving forward. So more scientific studies that establish validated, reliable, species-specific indicators of pain are needed. And this, as we discussed, is critical to detect pain and to determine analgesic efficacy, which is required for FDA drug approval. More drugs labeled specifically for pain control are needed with improved access, such as over-the-counter availability with appropriate safeguards in place, drugs with longer duration pharmaceutical activity and more convenient routes of administration will also help to incentivize their use. We need guidelines for the management of pain associated with disease and expanded guidelines for all painful procedures for all farm animal species. And alternative management practices are required to reduce the need for these painful procedures. So we need to investigate ways to achieve management efficiency while prioritizing animal welfare. So through improved housing designs and management protocols, through genetic advances, and improving management practices is also critical to reducing these risk factors that are associated with the development of painful disease conditions. As veterinarians, we must communicate the importance of pain management to producers. Veterinarians are trained in pain management with working relationships with producers. So we're really uniquely positioned to challenge these preconceived notions about pain, to help educate the public about the importance of pain prevention and mitigation, and then ultimately to help producers adopt preemptive and multimodal pain management practices on farms. Thank you so much for joining today. I want to thank Dr. Sabina Mann from Cornell for her encouragement and valuable insights into pain in farm animals. Here are some general pain references. I included references for specific studies mentioned throughout the webinar on the corresponding slides, but please feel free to reach out to me for any of these citations if you want to look into this research further. Please stay tuned for future webinars. If you have any questions about this webinar, feel free to contact me. My email address is at the bottom of the screen, and I am now very happy to take questions live.
Thank you so much, Dr. Zoltick, for that fantastic presentation. I think I can speak for myself, but probably most of us here definitely learned a lot and really appreciate your perspective. We have a few questions here from the audience, and if anyone else would like to add some, please go ahead. Also, if you are not yet a member of VAFA and you are interested in joining, just write the word member in the chat and we will get the process started of signing you up. Let's see, here's one. Thank you for a great presentation. I loved your summary of what needs to be improved on farm prevention and mitigation, or needs to be improved for on-farm pain prevention and mitigation. What are the practical things that can be done now? So maybe looking for some specific combinations, maybe on, for example, disbudding. Do you have kind of a general?
I'm so sorry, Wendy. I got very distracted by the chat. Can you repeat the end of that question?
Oh, yeah. Some practical things that can be done as far as for specific procedures, like for disbudding. Is there a certain multimodal protocol you'd recommend?
So generally, what is recommended right now is to have a local block, generally a corneal nerve block. You'll also find research related to horn bud infiltration with the lidocaine, that some people have found that to be effective, not for use with caustic paste disbudding, but for hot iron disbudding. So definitely you need to have the lidocaine on board to prevent the acute procedural pain. And something that's very important is to make sure that you have time for the anesthetic to take effect. So one mistake that people sometimes make is they just do the lidocaine injection and then right away disbud, and the lidocaine is going to take 2 to 5 minutes to take effect. So sometimes you can even, if you're working with a lot of calves, you can line them up and do all of your lidocaine and then go back and do your disbudding. And then you always want to follow up with an anti-inflammatory drug. Meloxicam is a great drug because it's COX-2 selective, so you're going to see less of those negative effects associated with renal function and gastric function. And then, as I mentioned, there is research available that, when we give meloxicam, for example, that's only lasting 48 hours. And we have to remember this is a 3rd-degree burn. So this pain is lasting far longer than 48 hours. And as we saw, from this research, that when you apply a stimulus, so if a calf rubs their head on something, it's going to be painful for, up to 9 weeks. And they have this ongoing pain. So even without applying a stimulus, they'll be painful for 3 weeks. So really thinking about more studies investigating this, the importance of potentially applying or administering more than one of these NSAID doses for adequate pain relief duration. Sorry, that was a very long answer to your question.
No, that's great. I really like your idea of the lining up the calves so that you can ensure that you're having enough time for it to take effect.
Yeah.
Let's see, we've got another one here. I think you might have covered this, but they wanted to know if there are any Grimace scales being developed for different farm animals right now.
Yes, so there is Dr. Viscardi at Kansas State University is looking into facial expression in piglets, so using it to evaluate the pain associated with castration and tail docking. There have been scales developed for sheep. This is for laboratory sheep, but I'm sure could be applied to farm animals, looking at post-operative pain based on facial expression. This is used by, there's a study by Glira et al. From 2015 where they look at dairy cows evaluating pain using facial expression. So it's very exciting, and people are working on automated systems to really make it an easier method of identifying pain, and you can detect it in real time as well. But there is still a ways to go, to validate some of these scales.
Let's see, we've got another one here. Are there any incentives for pharmaceutical companies to develop more analgesic drugs for farm animals?
So I don't have a strong, policy background regarding this topic. I think one of the problems, and Gwendy is very knowledgeable in this topic as well, so feel free to chime in, but we do have fees that I had mentioned that sponsors have to pay. So generally a sponsor is a pharmaceutical company. It could be a research group or an academic organization, but it's also often a pharmaceutical company. And there is a fee that they have to pay. And so if that fee could be waived, I think that that would definitely increase incentive. I think having these scientific studies coming out showing analgesic efficacy with certain drugs will help push this forward. I think general awareness about these painful procedures, these painful disease conditions, how much it impacts welfare, and it also impacts production. And so using that as an incentive to get drug approval moving.
Let's see, and one other one here. How can members of the public best support the work of farm animal veterinarians in farm animal pain management?
That
Any
is a
thoughts on that?
wonderful question. And I think even just coming to this webinar today, becoming educated, showing support, also being an advocate, you don't have to be a large animal veterinarian to become informed about these practices and their importance. I think sometimes there is a struggle associated with, and this is, in small animal medicine too, carrying a lot of the emotional burden. So I think that spreading that out among as many people as possible, knowing that we're all working towards the same goal, is very important.
Yeah, and I know at least some, so you mentioned earlier the dairy farm program, Farmers Assuring Responsible Management. When they update their guidelines every few years, they actually do take public comment. So I think, encouraging strengthening of industry standards can go a long way and may provide pharmaceutical companies with more of an incentive to go through the FDA approval process if they have a guaranteed market for their product. Let's see, and then there's one other one here. If you, from lay people, I frequently hear from lay people and sometimes fellow vets, unfortunately, that neonates don't feel pain, specifically in regard to castration, and therefore don't need analgesia or anesthesia. How do you practically convince them otherwise? Good question.
It's a very good question and a very big problem. I worked on farms for almost a decade before vet school, and I was always told that neonates do not experience pain. So it is a really huge problem. I really see the veterinarian as the most important person to communicate, having a working relationship with producers to try to overcome these false assumptions about pain in animals. I think also bringing up the economic benefits can sometimes really turn people, if you talk about average daily gain, things like that, that can also be an incentive.
Great. Let's see, it doesn't look like these are questions. And then I did just see earlier, Dr. Barry Kipperman, who's part of the leadership of VAFA, had his hand raised. I'm not sure if, I don't know if I think I am able to unmute you here, Barry, did you have a question?
Yeah, I inadvertently sent it as a private message in the chat. I'm so lousy with chat boxes. Abby, what a great talk. Is there scientific evidence that treating pain is a win-win for the producer, that animals gain weight more rapidly? Since costs are a barrier to this, is there ample scientific evidence that veterinarians can use to let producers know that this is a win-win?
There is evidence. I don't have the authors off the top of my head, but there is evidence of increased daily average daily gain. There was also a study about that you reduce the use of antimicrobials for things like pneumonia when you've provided pain relief for these early life procedures. I can definitely, I have these research studies in my EndNote, but I don't have them off the top of my head. But there is research, and I think that we do need more. Even though a cow doesn't care how much milk she produces, and we need to prioritize animal welfare, I think that looking at these economic benefits is valuable.
And then looks like we're almost out of time, but just one more. I thought this was interesting. We have someone from Australia mentioning the product trisulfan, which is a topical product that includes lidocaine, adrenaline, and cetrimide, which is an antiseptic. And it's used usually in conjunction with meloxicam for disbudding and certain wounds. They're asking if it's available in the US.
It is not.
Yeah, I think they are trying. Last I heard, they were in the process of seeking FDA approval for use in piglet castration. But we do have the individual ingredients, but not that combination product.
Right.
Well, thank you very much, Dr. Zoltick, and everyone for attending. Please, if you haven't joined VAFA yet, either put member in the chat or go to our website and sign up. Getting lots of claps and accolades here, Dr. Zoltick. So thank you very much.
Thank you very much for coming today.